Hello and welcome to another episode of Med Madness, your go-to podcast for all things medical education. Today we are diving into an essential topic, cervical cancer screening. We'll cover the guidelines for different age groups, the importance of PAPI tests, and the role of HPV testing. By the end of this episode, you'll have a comprehensive understanding of how to approach cervical cancer screening and why it's crucial for early detection and treatment. Next, let's discuss the screening guidelines. For women under 21, no cervical cancer screening is required. The incidence of cervical cancer in this age group is extremely low, and screening has not been shown to be beneficial. Now, let's move on to the 21 to 29 age group. For women aged 21 to 29, it's recommended to have a cytology or pap test every 3 years. This helps detect any abnormal cells early on, ensuring timely intervention if necessary. For women in the 30 to 65 age group, there are 3 options for screening. The first option is cytology every 3 years. The second option is cytology plus HPV testing every 5 years. The third option is primary HPV testing every 5 years. These options provide flexibility while ensuring thorough monitoring for potential abnormalities. Next, let's discuss the screening guidelines for women over 65. Screening can be discontinued if the patient has had adequate negative screenings in the past and is considered low risk. However, if there is a history of cervical intraepithelial neoplasia, CIN2 or higher, screening should continue for another 20 years, even if it goes past age 65. Now, let's talk about women who have had a hysterectomy with cervix removal. For these women, screening can be stopped if they have had negative prior screenings and are considered low risk. Moving on to HIV-positive women. Screening should begin at the onset of sexual intercourse or at the time of HIV diagnosis, whichever comes first. Annual screening should continue until there are 3 consecutive normal results, after which routine testing can resume. Next, we have immunosuppressed patients, such as those with systemic lupus erythematosus, SLE, or organ transplants. For these patients, screening should start at the onset of sexual intercourse. Annual pap tests with HPV co-testing are recommended due to their increased risk. Next, let's consider the risk factors for cervical cancer. It's important to be aware of the factors that can increase the likelihood of developing cervical cancer. These include tobacco use, oral contraceptive use, early onset of sexual activity, sexually transmitted infections, and high-risk sexual activity. These factors are associated with persistent HPV infection, which can lead to cervical cancer if not detected and treated early. Now, let's look at a real-life case study. Consider Sarah, a 34-year-old woman who has been diligent about her health checkups. Sarah has had regular pap tests every 3 years since she turned 21, all of which have been normal. At 32, she opted for combined cytology and HPV testing, which also returned negative results. Recently, she visited her gynecologist for a routine checkup, and they discussed her screening options. Given her history of negative results and low risk factors, Sarah and her doctor decided to continue with combined cytology and HPV testing every 5 years. This case highlights the importance of regular screening and personalized healthcare decisions based on individual risk factors and screening history. In summary, cervical cancer screening is a vital part of women's health, helping detect abnormalities early and reducing the risk of developing invasive cervical carcinoma. The guidelines vary by age group and individual risk factors, ensuring a tailored approach to each patient. Remember, effective study and retention come from active engagement. Make sure to participate in our pre- and post-podcast quizzes and utilize the Anki flashcards we provide to reinforce your knowledge. Thank you for listening to Med Madness. Stay informed, stay healthy, and join us next time for more valuable insights into medical education. Thank you for tuning in to this episode of Med Madness. If you have any questions or comments, feel free to reach out to us. Don't forget to check out our quizzes and flashcards to test your understanding of today's topic. Until next time, keep learning and stay curious.